And we'll be together for an hour and a half until 12:30. Feel free to come in and out as you need to. This is intended to be an informal, informative dialogue. So please feel free to participate as well. We won't be using the computers, but they're there if you need them. Okay, so I think we can start. Yeah. You'll want to turn your mics on, the little mouth button. Awesome. So hi, everyone. Welcome to the Governance and Stewardship panel. My name is Taylor Campbell. I am the Interim Director of External Affairs and Deputy Director of Technology and Innovation for the Los Angeles City Controller, Ron Galperin. So I'm here representing the city. I'm also a member of the Data and Donuts planning team because my boss, the controller, is one of the founding members of Data and Donuts. So glad to be here with you all today, and extremely excited to be here with my fellow peers here. I'm going to be here just as the moderator for today's discussion, and the majority of the show will be on these three here. So let me go ahead and start with introducing Drew. Drew is here he represents LA, Multnomah Water District, who's also one of our sponsors, so thank you. We also have Toki here, who's representing LA County, as well as Mark, who's representing LA County. So before we get started, I just want to take a scan of the room here and get a quick sense of who you all are and what agencies or cities or regions that you represent, as well as what some of your intentions are and expectations are for this particular session. We want to make sure that we're all aware of kind of the needs and the curiosities of you all so that we can make sure that we keep that in mind as we go through. So is anybody here an elected official? Okay, so are we all generally in the managers? Do we identify as managers? Anybody identify as anything else? It's okay, you can stay, but we're just curious. No? Okay. Oh, yeah. Management and staff. Okay, okay. So we're all kind of thinking about this in terms of kind of how we do data strategically, right? Awesome. Okay, and is anybody here from City of LA? Hey, family. County of LA? Awesome. Other counties, just shout them out. Other cities, other agencies. Long Beach? Okay. No others. That's fine. Cool. So we'll have a dialogue, and we'll also have some time afterward for a more formal Q&A back and forth. But as we go along, if you have any questions, comments, thoughts, please feel free to chime in. Turn your mic on. There's a little icon of a person with a voice. So use that, and let's get started. Okay. Cool. So thank you for being here. Lovely to have you. Let's just start with a quick introductions about who you are and what you do with your agency, specifically as it relates to data and data strategy.
Sure, thank you. So my role at Milton Water District is in finance, planning, developing water efficiency programs, and we're a local utility, sort of about 170,000 people in South Orange County, across 6 cities. So we do water service, do a lot of recycled water. We're 100% dependent on imported water from either the State Water Project from Northern California and the Western Sierras, or the Colorado River. So because of that, we've also invested a lot in developing recycled water, and about a quarter of our total water used within our service areas for recycled water. We also do wastewater collection and treatment for our customers. And in terms of data, we obviously get a lot of information on billing, customer water usage, operational data through like controls on SCADA. So really what it comes down to is how do we manage this very getting even more scarce resource most efficiently as a public good for the public. So taking that data and turning it into insights to drive decisions and helping customers understand and be aware of their own decisions as well and educate them. So those are kind of some of the primary kind of factors we use data for.
Awesome. Thank you. Toki?
Hi. Chief of Analytical Services, as well as co-chair of Data Governance Steering Committee for Department of Health Services, which we have 4 hospitals, over 22 clinics, outpatient settings, as well as some community clinics, about 200 or so that DHS deals with. So we have a lot of patient data that we slice and dice in different ways for, for many different, stakeholders, for example, our board, our DHS executives, and what have you. A lot of things that basically, just a couple of sentences to what our department does is, with respect to LA County residents providing healthcare. For example, we have about 450 or so impaneled patients that we try to provide primary care, which is preventive care for them, checking their blood pressure at, primary care visits and what have you, glucose count, and so they don't end up in the ER. So as we talk a little bit more about it, we can discuss a little bit more about what the data is, what we do with the data.
Thank you.
Sure. So my name is Mark Greninger. I'm the acting chief data officer for the county. We are in the chief information office, which is part of the chief executive office. So as opposed to my colleagues here, we actually have no operational role within the county itself. We are not responsible for delivering services to residents of the county, but what we are is a strategic arm of the county focused on identifying common platforms, and potentially what we're moving toward is answering questions that cut across departmental systems. So while Toki's shop is looking at analytics around delivery of healthcare, what we're trying to do is to enable the answering of questions about the impact of the delivery of that healthcare, the impact of policy changes that are obviously critical to the county. So the Board of Supervisors has a number of what they call priorities. Some of the justice reform is one. So there's been a lot of changes to the justice system. So we're trying to understand what the outcomes of those changes are. The homeless initiative obviously is a huge issue right now, and homelessness is an extremely complex problem that one department within the county is not able to solve, right? Because it's a combination of all of the services that we deliver. Child protection is another one. So there's all of these, I would say, broad needs to try to understand how our different services and programs that we provide in the county as the social safety net for the entire county, how they interact, and potentially look at evaluating which ones have the most impact, and what the impact of changes are. So you have to realize the county's budget is over $30 billion. So we need to identify that we're spending that money effectively. So that's one of the roles that we have.
Thank you. Mark, I'm really glad that you're here as a representative of somebody who's more strictly strategy and not directly services, because I think, are there people in the room here who fall more into that category of strategy leadership? Okay. And then are there anybody else who's something else besides strategy leadership and direct services? Okay, cool. So let's take it back to Drew. Let's talk about how you mentioned that you have a service that you're providing. It's water. It's a scarce resource. What are some of the questions that you ask as you start to prepare for the direction that you head with regard to data governance and stewardship, specifically in terms of the goals that you're trying to reach, or the business challenges that you're trying to solve?
Oh, that's a great question. So water being a scarce resource, a lot of the questions we're asking are, how do we optimize the use of capital? Where water is very capital intensive in terms of building pipelines, pump stations, and trying to move it around. It takes a lot of energy. So how do we do that better, faster, cheaper, and looking at just like any municipal kind of a utility, infrastructure is getting older. So how do we look at the right time to replace that? What do we, as we look to develop new water supplies, expand services, what's the cheapest way to do that? What's the right time to do that? And the more that we can integrate different data sets across our operational staff, our engineering staff, our financial systems, and integrate those, it helps to answer those types of questions. And that's really what we've from our leadership and our general manager really strives to break down silos and integrate those different data sets across different departments so that we can make sure that we're making the right decisions.
Toki, do you have anything to add on that from the health services perspective?
Sure. A lot of the decisions that are made by our department is actually looking at a lot of the data, that the quality of the care, patient care. So almost everything is, the data is being used for decision making, for policy. And so, and aside from that, we are also doing a lot of initiatives that require reporting to the state and federal agencies. So dealing with all kinds of data and how to make sure that the data across the different systems are actually linked correctly.
And Mark, that makes me want to ask you, the theme here, I'm kind of pulling out of themes of data for insights on policy and reporting, data for insights on services and quality of services, and data for insights on capital management and just being able to be efficient with spending. How do you have any examples of how that applies at the county-wide level for you?
So right now we haven't embarked on our capital management, and we haven't started communicating with our auditor controller to look at all of the information coming out of our financial systems. Right now we are really focused on the health and human services, social services side of the house, because that is really a pressing need around some of the initiatives that we have out there. But in terms of the data that obviously for what we're trying to do, one of the things that we run into is we do not create our own data. We are dependent on the administrative systems and source systems from other departments. So looking at what's interesting that you run into, and I've dealt with this in many cases, is that it sounds like a simple question, but the information or data needed to answer that question can be extremely complicated. So
how so?
So one of the points that the best source of information that's out there, and this is an administrative system, something that is used to communicate with clients and with the residents on a daily basis. So as opposed to some kind of an aggregated system or some other source, the information from an administrative system is actually used to provide the service, right? That's in effect, the golden truth of how a department is interacting with its clients, right? As opposed to something that they've used for analytical purposes. The problem is the purpose of an administrative system is not to produce reports, right? It is there to provide and manage services. So sometimes the information that's collected is not designed for the policy questions that we're trying to answer, right? So sometimes it's trying to understand, well, what you have to understand is the purpose of why a certain set of information is collected, and it's not always there to answer a policy question. It is to help a caseworker determine eligibility for somebody, right? It's not a matter of, well, what's the level of, what's the impact of this service on a health, related thing further down the line. So some of the examples, we have so many administrative systems, and we don't have a single person identifier across all the same systems, all the systems that we have. So that's an example of that we're trying to rectify, which is understanding one person's interaction with all of the systems in the county, of which there are, I'm sure, 30 or 40 main systems, but there are many, many little subsystems and shadow systems that are out there. So understanding how one person has received a mental health service, gotten some benefits from DPSS, been in jail a couple times. Connecting those dots has actually been one of the more challenging starting points, and that's where we started from, to try to enable this view of the client, with our 360-degree view of the clients that come to the county.
So you're really looking at it from the individual impact on the individual level, and then working your way up.
Well, so again, from the best analysis comes from the most granular data, right? That's the key thing. So what we see a lot. Anybody from public health here? Yeah. Okay. So Stuart, the one thing that I will. You have a lot of information, but a lot of the public health programs only provide data in aggregate. Well, you can't understand when you get to that level the impact of a program on a person's outcome. You can kind of say, well, we spent X amount of dollars and this trend changed, but you don't know necessarily why, because you can't connect that a program that a person interacted with that changed this outcome, right? You only get these broader concepts, and a lot of that has to do with confidentiality and the history of that, but that limits the ability to track other impacts potentially on that person.
Drew, did you have something to add to that? Maybe you did.
Yeah, no, I'd just say we have a lot of really sensitive data. I think we've been trying to look at opportunity that nothing is sensitive as, it's just different, I guess. We have critical infrastructure that obviously you don't want hackers or anyone to get access to, but and then we have personally identifiable data, but we've been looking at ways like anonymizing it, or looking at ways to use that, clean it up, and then use that through partnerships with other entities to help with evaluating the impacts at an individual level. But absolutely, individual data is the best. It's just trying to develop. I think there's a lot of effort in trying to anonymize or look at ways, depending on what the data is and how sensitive it is, and developing a way to get it to the right people.
Do we have any questions or any comments before we continue?
Going back to the issue of sort of, getting that granular data while maintaining confidentiality, what are some of the strategies that or approaches you've used to sort of allow that to happen? Because it's one thing to say, oh, we'll anonymize it, but how can you do it in a way that sort of satisfies everyone and still provides you the quality of data you need? To everyone, I think you all could have input on this.
And I want to add before you jump in on that, from the perspective of a manager, not necessarily from the perspective of the person who's in the weeds with the data, but what kinds of information should managers know to be able to do that?
Absolutely. So we have transaction data on water purchases from individual customers. We often will aggregate it up to, so we have individual houses, specifically which parcel is being served, but we'll aggregate it up to a neighborhood level. So we'll often aggregate it up to a census block, maintaining the individual water usage data, but it's associated with a census block instead of a individual house. So matching it up to, so you maintain the individual behavior choices, but avoiding getting into which exact person is wasting water or using water inefficiently. That's been very effective in sharing that with researchers, or partnering with neighboring agencies who might see value in using that kinds of data, but we want to make sure we protect that confidentiality.
Oh, I didn't know if you wanted to jump in. Yeah.
So kind of off what Mark was talking about in terms of rectifying different ways of identifying people. From a resident perspective, we don't just interact with, say, with the county, we also work with the other 88 cities or the state or things like that. How do we work towards a world where we can, it's like, the dream would be you sign on once, right? And then like different government agencies, and you don't have to keep putting in our name and address and the same thing over and over again. Can you talk about how you can collaborate with other local governments, other governmental agencies to work towards that?
How do we collaborate with other agencies?
Well, so there are some initiatives that our office is working on, which is what you're talking about is like single sign-on to government. So that's not, here's the interesting thing. To me, that's actually not a data issue. You've expressed a business requirement. And fortunately nowadays, technically, there's ability to have, if you go to a number of places, you can sign on with your Facebook ID or your Google account. So I think for at least we don't even do it within the county, right? Just to give you that heads up. So we're still focused on single sign-on into the county, but we can talk about Active Directory integration and B2B, business-to-business authentication, but those technologies are starting to come. And so we are working on that. The hard part that we deal with is that some of our systems are so old that they don't connect to those more modern identity, what we call identity management capabilities. So it takes a fair amount of uplift and investment for the hundreds of systems that we in the county run to connect to that. But at least the technology is there. So we're actually having that discussion to potentially look at every single system upgrade, every single new system must connect to an identity provider like that.
So back to the original question, our data is HIPAA protected and not everybody has, access to the data. And also in terms of our reporting, we do a lot of population related reporting. We don't report individual reports. And for those that we do that, people who get that kind of data, for example, are providers that that are supposed to take a look at it and make decision based on their care.
So to follow on with one thing that if you're talking to a manager about data sharing, one of the tacks that we've taken is actually look at the law, right? Mm-hmm. So what you think of it, everybody hears about HIPAA. HIPAA. You can't share. That's absolutely not true. It depends upon the use case, who's receiving it, and what the business purpose is, right? Those are critical determinations, and many of the federal legislations actually have exceptions around data sharing for specific purposes, right? So if it's program evaluation, if it's for research purposes. So we've actually had our county council sit down and really look at the law and make a determination on what can be shared with who for what purposes. So there's a knee-jerk reaction, which is, well, we can't provide that information, but yes, in certain cases you cannot, right? Obviously, but in some cases you actually can. And so you have to identify the business need that drives a request for confidential information or PII information. So it's been a fun journey for the last couple of years. We have had our council looking at this and identifying, and we hope in the next few months to publish or share at least their results to connect a business need to a use case to this is the information that can be shared. So the other thing that we're doing is, remember the term, it's actually written, I think, into HIPAA as integrated data system. You can have something we'll talk about later as data stewardship. So information can be shared to a data steward who then enforces the rules about who can access that. So that's the role that we're going to play.
So just to
Toki,
add on to
Toki,
what Mark said.
Can you turn on your mic?
There you go.
Just to add on to what Mark said, different people will ask different kind of questions. For example, recently we had a request even within the county with respect to opioid related drugs and wanted to know how many patients, for example, or what clinics were actually prescribing that. That's something that I will not make that decision. My boss will not make that decision. We'll send those kind of things absolutely to our attorneys, to our county council to make those kind of decisions.
Yeah, no, I think made some good points on just the value that we have with data, and it's almost like flipping it on its head. If there's a public policy benefit to researching a given problem, and someone puts together a use case through some sort of value case for looking at a different data point, most of the times what we found is that the law, it can be either ambiguous or as long as there's a public policy benefit, especially with regards to for like a water utility, personally identifiable information, and there's a lot of standards on critical infrastructure information, but it's flipping it on its head. Okay, why can I not share it? What can I not share? And then how can I still help solve that problem? And instead of, okay, it's a PII, CII type of problem and I can't do anything, that's usually not the case. There are frameworks out there for how to share that type of information and deal with those types of issues. And we have a lot of valuable information that can be gleaned from the data that we collect. So how do we look at opportunities to share it when we can, instead of why can we not share it? I think that's a key question to ask.
Mm-hmm.
My question is, right now, with the visualization tools, it's very easily to visualize data. Like you could say, okay, analyst A, you have access to this data. But what do you do when it's so easy to share that data? You can right click and share to anyone in your agency, and then you can't control like a cascading sharing of that. How do you contain that to the people that are able and have the right to see those data sets?
Let's answer that question in a bit, because I want us to flow into kind of getting to data stewardship, and then I think we can answer that at that point. Any other questions before we move on? Okay. So I personally want to get you guys' insight on the process by which you identify what the business needs are in the first place, that then lead to use cases, that then lead to understanding what exactly you need and if it's legal to get, and who should be in charge of giving it to people, et cetera, et cetera, et cetera. So taking a few steps back to the beginning of the process, it's my understanding, I'll start with, it's my understanding that should be step one. Am I right is the first question. And then also, how do we start there? How do we identify, what processes have you gone through to actually identify what the business needs are that data might help address?
Absolutely. So I think like at most public agencies, we have our own kind of strategic planning process. And actually, a good example is a couple of years ago, we were looking at whether to expand our storage for our recycled water program. Recycled water, as you can imagine, is primarily used for irrigation purposes. And so very high demand in the summer, very low demand in the winter. And so the source of that's wastewater. And so that's more of a constant from indoor water uses. And so we have to store that in the winter to use it in the summer. If we're looking to expand our system, how much do we need to expand that? And so we were looking at that from our exec team and talking across departments. How much should we invest in on a dollar for dollar basis? So like what we're looking at was about a $20 million project, and so big ticket dollars for our agency when our annual capital budget's $30 or so million is a good chunk of the whole capital budget for our agency, and so. We looked at what data do we have, and actually there's some people from the group DataKind. They put together volunteer data scientists to look at answering questions. We put together that as a use case and connected with some really talented data scientists, visualization experts. And they evaluated that problem, and what they found was based on trends and using modern data analytics that we didn't need to build that reservoir. And so huge value. We were able to, because it was a key kind of a need from the kind of like executive sponsorship at our agency, able to look at how do we like get data across different teams and collaborate to get that data to them. And it came from summary data from our SCADA system, like daily water that's entering the system in the recycled system, and using that to develop pretty high resolution forecasts for what we would need in the future. And that was a huge value add, and it really helps also to continue that momentum and identifying business. I think it starts from developing a use case, what data sets you need from that to answer that use case. And I think that's kind of the process we went through.
Does anybody not know what a use case is? Okay, can we define use case, please?
Sure. I'll take a crack at it. So
layman's terms.
Yeah. So use case is simply describing, it's like a problem statement. What's the question that I'm trying to answer, and what do you think would be needed to answer that question? So it's kind of laying out in layman's terms what the problem statement is and how you would answer it.
Mm-hmm. And I think of the word use, it kind of reminds me of like, how would people use the thing, right? To kind of help frame it a bit. So like, am I using water? How does this play out in like a behavioral way, right? And then working backward from there. Okay, well, in order for someone internally to be able to use this, then these things need to exist. These things need to be in place, right? So the use case for this conference is like, a manager wants to go to a session. Okay, well, there needs to be a session that exists for them to go to, et cetera, et cetera. Okay, so back to the original question about identifying the business problem or the challenge.
So our business need is very simple. It all goes back to patient care, patient care, patient care, and everything that's related to that. As I was mentioning, for example, one of the reasons that we decided to impanel patients to specific medical home clinics is to provide preventive care to stop them from going to ER, for example. And, there are programs that we risk stratify. How can we actually intervene here? For example, patients with diabetes before they get into, the foot amputation or blindness, what can we do? Actually, THS has had a couple of different programs that has managed to get to people on time to do that. Everything that we do really goes back to the quality of patient care that we're providing. And as I mentioned, the decisions that we are making, whether it's, about specific clinics or whether we are seeing a spike in our ER visits. So what is it that we are lacking? We look at it. Okay, so why did it go up by 20,000 per year? When you have over 500,000 patients per year and over 3 million visits, there are a whole lot of different needs that can be answered with that data. So we do a lot of slicing and dicing to answer specific questions.
So in terms of identifying business needs, there's actually two models, and actually data science doesn't fit into one of them, ironically, I think. But so one of the key things that we have within the county, and hopefully you have within your department, is a business strategic plan, right? So most of our business needs your business needs really need to tie to the strategies that you have in place, right? Whether or not it's preventing homelessness or improving patient care, right? That really makes a big difference when you're trying to get sponsorship around doing something, right? So we in the IT side or the data side of things can have ideas, but if you don't have an executive or someone who's going to sponsor that and drive that and implement the changes or implement that, you're always going to run into problems. So one of the things that's always critical, and we can talk about it within governance, and the governance section is how do you tie, the data and the information technology to the business side of things. And you need a sponsor who can assign somebody who's going to be responsible to make that happen. to follow up to say, how's that going, right? Have you solved my problem yet? Or have you solved, this issue? And then to move forward. Now, the one thing that there's a challenge is we hear about data science a lot. Data science is kind of in some ways driven the other direction, which is here's a bunch of data. Tell me what we can do, right? So you still need a business sponsor who understands that we don't know what we're going to find, right? So a lot of business use cases start with, well, I think that from my experience, this is the case, and let's go investigate and do something about that, right? But this other maturity of data, which is, well, I'm going to set somebody up to work on, here's a pile of information. What are we going to find that potentially then ties back? You have to, if you're going to make a change from that point, you have to tie it back to a strategy, right? Well, if we do, I found that, empanelment's working this way, or having, would be better, right, for a patient outcome. But that's the challenge, but start from the other side.
So Mark, can you talk a bit more about the process of understanding and identifying business sponsors, specifically giving advice to managers in the room, right? Like that might not be something that people have or have access to. Does anybody have access to potential business sponsors for kind of managing their data in a third party kind of way? Yeah, okay. But some, there may be some instances where that's not an option. So do you have any recommendations there or kind of advice?
Well, I mean, the key, again, if you go back just to the strategy, right? Sometimes it's actually to find a business, it's a communication, right? If you understand the business that you're in, and that's an advantage if you've been there for a while, to understand the pain points. But a lot of times these things come out of small communications. I was just talking, the hallway talk with somebody to ask, what's the biggest problem that you have, right? And if you let somebody communicate that and then come back and say, well, I think I can solve it by doing these things.
Yeah.
So one of the things that we're trying to do is bring data to the table, in a sense, when you have executives that are dealing on the day-to-day basis. If you can potentially do a presentation at your manager's meeting or even at an executive meeting, doesn't have to be long, 5 to 10 minutes to lay out what can be done potentially, and to get people thinking. Then you start to find that champion who can start off with one project and then you move on from there.
Yeah.
Yeah, I just added someone who's often the executive sponsor for a lot of these kinds of use cases. I think it's absolutely spot on. It starts with communication, but laying out a value proposition. What is the value of solving the problem that you're going to solve in a clean, simple way? I think really goes miles to invest in these types of efforts.
And then to touch on another point that you made, Mark, you mentioned the beauty of having data available to discover what challenges are rather than coming into it with kind of a set assumption about what the data will tell you. How does that look? How does that look? And also from you, Drew, and Toki, on a service level, is that something that you've experienced before? And can you talk about the value that might bring, that type of approach might bring?
Yeah, so one of the initiatives that we're working on is our justice reform. So there's some people have, the concepts of what's happening, or they can be worried that the data will show that their programs are not working. So I think one of the things that we try to communicate as well is the fact that it takes a leap of faith to let the information guide you. So there has to be openness as a starting point. So we're building metrics around justice reform, right? So the group, the thing that we're being very, very careful on is is ensuring that, one, this is not a situation where the numbers are going to be used to criticize departments for certain outcomes.
So communicating that
up front, but the executive sponsor, who's one of our assistant CEOs, is on board, which is, this is just the data. It's not about turning around and saying, why are you incarcerating so many people, right? It's not that. That's not the goal.
Is that a fear that you guys have experienced or maybe even experienced yourselves? Yeah, I think that's something that I hear about a lot. So thank you. Can continue.
So I think one of the ways that we're trying to resolve that is actually to communicate before we have these big meetings, talk to the agency or group that we're going to discuss their information and share that first.
Mm-hmm.
Because maybe there are subtleties around the way that, remember when I talked about the administrative systems? Well, that data is collected for this reason, not for the reason that you're going to present it, but you give them an opportunity to understand what is going to be presented so that they have an opportunity to explain it, not defend it, but explain. So, well, are your numbers correct, right? So it'll be interesting to see how that works. Because we're on a continuing basis to communicate the impacts of programs a lot of people have vested interest in what they've built. So
yeah, I think that's good advice.
Oh, I just add, I think that it's good to find like data champions in other groups too, because it's as much as it's like from the finance and water efficiency, when I'm trying to work and get data from other groups, it's good to find kind of the advocates you can find in other groups to collaborate with, and people often are afraid, like, okay, well, are they going to take this, and are we not doing enough, or do we have enough, or are we having a whole bunch of pipe breaks? Is there an issue or problem? But flipping that on its head, it's like, okay, if we have a problem, how are we going to deal with it? Well, we have to sell electeds ultimately to get more resources to solve that problem. And the only way to do that is with data and telling that story and understanding that. And so that's flipping it into why that problem exists, how to solve that problem. It really helps develop trust and build bridges across different groups so that we can work collaboratively. Ultimately, we're all working we're all working to serve the public better, faster, and I think building that trust across groups is one of the most critical parts to solving interdepartmental data collaborations.
Mm-hmm.
Since our office deals with a lot of the patient data coming our way, and sometimes the way that the data is captured and management of that data, the way the data capture is not the best way. For example, after we had our electronic health record systems going up, even though in the past we had multiple systems, so the EHR was supposed to make it into one system at the beginning. Each facility still started at trying to have their own take on it. So when you have that kind of thing, you really cannot rely on the data for the things that should have not have, the fields that should not have had free text, for example, would have free text.
Mm-hmm.
So one of the things as data governance committee that we took on, starting to look at the data elements that are important for capturing the data that's related to our patient care. Something as simple as type of admission, for example. It used to have 38 different drop-down menu. It really, the state has 5 or 6 options for the drop-down menu. So that's one of the things that we put in place, that not to be able to actually put in whatever you want to do, free text, bringing, transferred from this facility or that facility. So it's sort of for both of my roles that we're able to look at the data and the sanity of the data and then see what we need to actually do through the data governance in order to remedy it, if we can.
Yeah, I wanted to now kind of move into that next phase, right? Which is, okay, you've identified the challenges, you've built the trust among your people, you've communicated openly about the value of moving forward in this way and how it will be presented and mitigating all the fears. And now you're ready to begin. You've identified a champion, maybe even a committee of champions who can help really start to dig into what it means to use the data to help you achieve these goals, right? So can we talk about, first, can we define some of our terms. This is a governance panel. So what is data governance now that we're at this stage? Start with you, Drew. And how does it relate to your world?
Yeah, no, I think it's a good question. In terms of how we as a utility and providing service have data governance internally, it's been very informal. I think we're not nearly as complex as in terms of the county or the city, and so that's provided a lot of flexibility to work through research partnerships and that. But what I would say is where we've developed more of a complex data governance is through collaborating with other utilities and trying to, and because I think that data can be often very different, data stewards can be often protective of their relative data sets. I think what we've taken is more of a kind of a consensus-driven approach to that, so that everyone feels like across different utilities that we're all having an equal and a heard voice in that discussion, to make sure that there's complete alignment in any approach. And I think that's been helpful. It's slow, but it also helps to make sure that we don't go in a different direction and you lose potential collaborators and partners in that effort. So I know Patrick will talk later from the Data Collaborative, but we have a coalition of water utilities that working together to create data standards and work towards sharing resources and developing analytics, and that kind of consensus-based approach, while slow, is also maintained consistent momentum, and it's been very helpful in making sure that we all are in alignment in how we approach these problems.
Thanks.
So data governance for us really is putting and pulling the data out of the system and trying to basically look at it and be able to actually use it again for patient care. I keep going back to it. So as simple as that sounds, trying to ensure data quality, it's hard and it's been a hard journey with respect to that. And we need to drive data literacy across the system, and that's been actually harder to try to do that. And as Drew talked about, data stewards, getting people on the front end involved, because those are the people that actually care about the data. And so overseeing the data stored and the quality of the data, monitoring of the quality of the data with their help. Those are the kind of thing actually that our committee has been very involved with for the past 4 years or so. And we got a long way to go. Our data stewards, for example, when we have consultants coming out and helping us, one of the recommendations for data stewards was at a high level, for example, the physicians that really care about this specific kind of data. That didn't work. Physicians are busy with actually patient care. We actually had to try this 4 different times before we actually found the data stewards that are on the ground, care about this, sitting down and going over specific things like trauma patients. Some of our systems, even though we have it in EHR, they're not capturing it, through EHR. They're still doing some manual processing of the data, which I just could not believe that. So trying to get those people involved and actually walk through, okay, how do we actually get you the information in our EHR? How can you actually use that instead of, doing this on a daily basis for, $5,000 a month or what have you. So that's been sort of our process.
So I look at governance. There's actually, I think there's 2 different levels of governance, big G, little g, however you want to call that. Governance at a broad level is really about, it's how you just make decisions, right? I mean, it's decision making, right? So identifying potentially which data elements or data sets are critical, identifying, who has authority to make decisions, or a group. And to me, we talked about linking the business to the technical. So the governance group, however that's done, usually connects these business needs, right, which come in from your strategic plan or your strategies, to the actual day-to-day operations and standards needed to support those business needs. So that's the kind of the big governance model. So a lot of times you'll have, and one thing to look at is if you don't have a governance committee or a group within your agency or department, look, you have to have a charter, right, which identifies the vision of what you're trying to do, the mission, decision-making processes, and potentially one of the first things to do within that governance group is actually establish a strategy, right? This is what we as a group are going to try to accomplish in this next 1 year, 3 years, 5 years, right? Tying that to the goals, right? There's a reason why we do this action and ask this data steward to do this, because it's going to help that, right? And tie those two together. So really you're trying to enable decision-making. And it's linking it again back to the business requirements. Like what are you going to enable through this governance infrastructure, right? That's the kind of the big G, which is the people, the processes, things like that. Now, when you talk about data, the little g, which is, well, what's your data taxonomy? It's much more data focused, right? What's the quality results that you want to see is really governing the individual sets of information rather than this broader concept of decision making. So you can have, we have data governance tools which theoretically can link every business term to every data element, right? But it's the big governance that says you have to, or you should do this. We need to establish a data standard because it's going to have this value, right? I still remember talking when I first started getting into this role to a chief data officer, I forget where he's from an insurance company. And he said, look, I knew that we had a problem with our data in this one field. And I kept on bringing it up and bringing it up and bringing it up, and nothing happened. And then all of a sudden a critical business mistake was made because this data wasn't clean. The next day I had $1 million in funding to go fix that problem, right? So that's what governance does, right? You're aware of it, but the decision-making process is, look, if the business doesn't see the value, he said, I learned my lesson. I'll have a plan in place, but it's up to, I need to execute another time.
So let's talk about data standards. And to get specific, what are some data standards that you employ at your agencies, or recommendations that you have for folks in the room?
So the nice thing about being a water utility in terms of in all water utilities, we'll send out bills at a set frequency. Some of us do it monthly, bi-monthly. We all bill for water usage. And so what we've been doing is collaborating across utilities to set standards, because it doesn't really make sense for me as a utility to set a data standard for for water usage data or bill data on my own. If the next utility is going to set a different standard, and so especially if we all want to partner with research universities and share data across to help with regional planning on water needs. If we all set different standards, it doesn't really make much sense, because then we all have to develop our own mapping to integrate them. And so we've been collaborating and setting standards to work through the data collaborative, and that's been really, really helpful in they've developed schema and worked with all the different data stewards across utilities to develop standards. And that's been really kind of the approach that we've taken, is more trying to collaborate across utilities in setting some standards and collaborating across that. One of the big questions in the water industry a couple of years back, there was a bill passed, AB 1755, which basically requires a lot of the state agencies to open up their water data. And so we've engaged with them in those processes, because we see value at the local level in a lot of those data sets. And so I think in the water sector, it's really helpful to work collaboratively across groups to set standards, just because if we set our own internal standard, it becomes a mishmash across utilities. And so I think one of the biggest things is just collaborating across different and working more in a regional or state, even federal, level. I think that's been very effective. The electric industry, for instance, sector has done that. So you can look at a zip code level price of electricity across the entire United States. We don't have that, but it's something that the California Data Collaborative has been working to do on water rates. And so setting those kinds of standards, I think my key thing would just be working collaboratively is the best way to do it.
Thank you.
I completely agree with Drew. And as far as what to recommend, you need to figure out what is your 5, 10, 20 data elements that's most important to you. And when we started our data governance committee, we actually started with the top 10 data elements. And we actually had to go, in our committee, there are CIOs, CNOs, it's across different fields, but we still had to get all the boots on the ground involved with that. So we went ahead within about a year or so, we actually went through 10 data elements, had to standardize it, and then try to implement it and making sure monitoring of that data, which, it's ups and downs. And so, but you need to figure out what is the most important data element for your need.
That's good advice. Thank you.
So one of the things that when we talk about standards, I think that there may be more, but think about it in terms of at least 3 different measures, right? Accuracy, completeness, right? So how accurate is this information? How complete is it? So, social security number should be filled out or not. And consistency, right? Is it filled out in a consistent manner? So our social security number is captured with 4-3-3 or 4, just one 10-digit number, things like that. What's your model? So start with measuring those. Don't worry about, that. And then identify, and as you said, once you understand which fields are important, then actually to track those and monitor that and identify the level of effort it's going to take to change that, both from a data perspective. So if you're a data analyst, I'm sure a lot of the work that you do is around data, what they call data wrangling, fixing data before you can actually use it, right? Throwing out these data sets, oh, we don't have that information, so, I only can use 80% or 70%. But what you said is identify the most critical field. Don't try to fix everything all at once, right? It doesn't work that way, right? That's not going to help. So that's really important. So, one of the perfect examples of a data standard that we have an issue with, that many, is race or ethnicity or both, right? So we capture a variety of information around that, right? It's a fairly complex one. Do you capture that upon entry? Do you allow something called other? Do you allow 2 values for race, right? Which is a more common situation right now. Do you deal with ethnicity, which is very, very different, right? And how do you capture that consistently? So one of the things that will be interesting as we put all of our information together. So one of the things that we're doing in our repository is how do we handle things like race? Because the first couple of data sets that got connected, you see same person, 3 different races, right? Okay, that's why is that happening? And one of them could be other, one of them, so, and one of them was not a race, it was actually ethnicity. So things like that, you start from there. But should we define a county-wide standard for how that information gets captured? Potentially. Another one that's near and dear to my heart from a while back is around address information, right, which is a critical piece of information. How is that structured? Is it 1 field? Is it 3? How do you actually capture that information? How do you verify and validate that? So standards around that. So, but again, but the other key thing to do is potentially write the standard down and figure out how you can implement the standards into your systems, because I know DHS has this issue where you clean up the data on the back end, but if you don't change the way the information is entered in the system itself, it's just over time, it's going to get dirty again, right? It's going to get dirty again. And then, the best thing to do is to change the administrative system itself to capture that information.
Yeah. And sometimes if you don't want to reinvent the wheel, you can borrow data standards from other agencies, other institutions.
How many of you are familiar with NEAM? No? NIEM, I forget what the acronym stand for, but it's actually a National Information Exchange Model. So have you heard of HL7, right? Which is the health. How about the Justice XML? These are all federal standards, or not standards, but it's a way to exchange information in a structured and consistent format. So it is a really good starting guide. So our first starting point was, how do you define a person? Right, that's the core information that we're trying to collect, everything around that person. So what's a person? What are the pieces of information that make up a person, right? Yeah. So things like that, and then collecting information consistently around, date of birth, for example, shouldn't be 200 years old, right? So.
Yeah, just add to what Mark was saying. For example, some of the data elements that we looked at to see, what are we reporting for state or federal? And there are already options, type of admissions, for example, what I was referring to the beginning, that was one of the things that we do actually have to report this to a state. There are 6 for drop-down menu, and people were actually going from what we were doing in the systems and doing the mapping to these 6. So we adopted that, because it's already a standard out there. You don't have to reinvent the wheel for things that are already existing, that we are already reporting on. So we absolutely looked at that and adopted some of those that were applicable.
I wanted to make sure that we went back to the question that we got earlier, which was about how do we manage the challenge of the flow of data, whether it should be shared, and making those decisions, but also setting those boundaries around who's able to share what, and what happens when something gets shared that maybe isn't supposed to be shared.
So around health data, there's so much restriction around it that, for example, a few years back, the nurses at UCLA who had looked at Britney Spears records. So the state actually has come out with rules that now it's not just the institution that is responsible. People are actually responsible. So if you look at something that you have no business looking at it's $25,000 per person. So is that kind of information gets shared with all of our group. Like I said, our office, we have access to the data, but for example, people cannot look at, patient data from home or other places that, you can't really access the data. However, as many as IT restriction that they put around that what you cannot do, people always find different ways. So thankfully, within the past 10 years that I've been with the office, we haven't come across any of our staff using the data the way that they should have done it. But that's the only comment.
I just say it's like any short type of decision that an entity might make. It's balancing risk with the potential benefits. Anytime you share data, there can be a breach. It's like every week now we see major data breaches from big private companies. And then I think that's a good thing to keep in mind, is that when we're looking at PII, people have more of an expectation that everything's public today than they probably did 10, 20, 30 years ago. And I think that too often government agencies will avoid working and trying to answer key questions and partnering with researchers and sharing data because we're afraid of what happens if it gets out. But I think that we also need to balance that with what happens if we don't try to answer those questions, or what happens if we didn't do that research project too. And there's a benefit to that. And so that's we try to work a lot with researchers to answer some of these big questions. And there's risks to that. I think that the benefits outweigh that. And I think that that's the key decision point, is looking at any sort of what data do you have. If it's if healthcare data, there's levels of risk and punitive fines that we don't necessarily have in the water sector. But there are very strict rules on the infrastructure, for instance, because that's covered by Homeland Security. So that we have to be very careful with regards to that, and like getting access to like our SCADA systems and things like that. If someone hacked that would be a disaster. So I think it's segmenting, looking at what kind of data, what are the risks with that data, what are the benefits for the research, and balancing those to make the decision in the public's interest.
And the best people to help you figure that out are sitting in this room, so make friends.
The one thing I would also say is, I mean, I think some of the question was exactly how do you control access?
Mm-hmm.
So a lot of the data that where we're putting our information together is actually in the cloud. So we're going to deploy everything into Azure, right? And AWS, Amazon Web Services, exists as well. There are a lot of so that's where you partner with your technology companies that actually have a lot of capabilities around direct control, logging, auditing, access control to individual records. I think one of the solutions that we've had is, look, the information, obviously you can ensure it's encrypted upon transmission, stored in an encrypted way, but you can also have it's amazing what people are coming up with. Raw data, PII, it's all in there. But upon viewing, it's automatically obfuscated. You can establish rules around as a person who doesn't have access to that information, you actually can't see. You can see a name, but it's not the right name. You can see a social security number, but it's not the right one. Going back though, what's actually kind of important about that is sort of a question that was asked earlier, is identity management. So one of the things that we are really trying to connect all of our systems to is actually to our Enterprise Active Directory, our Enterprise Identity Management System, which gets updated as people move from department to department, right? So I don't need to manage potentially the logins and connections of 110,000 county employees, right? I let, when they onboard or when they leave the county, they'll automatically be removed from our directory systems, and that revokes their access to certain pieces of information. And of course, the other starting point is start anonymous. There's less risk of a breach at that point, and provide access to PII or the person information only when especially authorized, and then make sure that you monitor and check to make sure what's being accessed. So
thank you. Let's talk about metadata, which is an important piece of maintaining your data standards, your data governance. How does metadata play a role in what you do, and what kind of advice can you give to the group about, or things that they should know about metadata, even if it's not something that they interact with themselves?
Yeah, so I'll define with defining metadata. Effectively, it's contextual information about the data set. So not the data itself, but what is the data? What does it tell you? Is it name? What type of name? And so if it's GIS locations, maybe the accuracy of that data. So it'd be background information on what type of data each column or however the data structured is, and just provide that kind of context. I think the key thing with metadata, it's relatively easy to ask an analyst to put together a chart and develop analysis for a given problem. But if you don't invest in like making sure that the metadata data is cleaned and understand what the data is telling you, it's very easy to also draw incorrect conclusions. And so it's like kind of the 80-20 rule. 80% of the time spent cleaning and understanding what the data actually is and isn't, and then the rest is on the analysis. And so not looking at metadata, not investing in developing the metadata for an unclean, messy data set is like asking that question without really understanding what the data tells you. So I'd say that it's probably one of the most critical first steps whenever you start looking at a data set is what's the metadata. So like you need to invest in it, and it's one of the most critical pieces of any kind of analytic project that you ask as a manager is develop the metadata out, making sure all of that is out, commented, and that it really is the foundation of making sure that what the question that's being answered is repeatable, so that another analyst can pick it up and be able to make sure and verify that the analysis was correct.
Very well said.
Mhm.
I have nothing to add.
Yeah, so before I took on the chief data officer role, I was the GIS officer for the county for 15 years. And the thing about that's really frustrating to me coming into this office, at least in the GIS world, there was a standard of metadata.
Mhm.
And the metadata was actually attached to the data set. It was an XML file that went along with it. It's embedded in the thing, and all the systems read it. That's advantage with one company doing the whole thing. But the one thing that metadata is often, metadata is critical, but sometimes it gets lost as to what the purpose of the metadata is, right? The purpose to me is somebody who's never seen the data set before, doesn't know anything about it, can use it in a consistent manner without having the data steward there to explain it, right? If you have connection to the person who created that data set, yeah, you don't need metadata, you just call them up, right? Hey, what does this mean? Why am I seeing these weird values and I don't get this, right? And why is this information collected? So it's about, purpose of why this data exists and how you use it. And the number one thing is, what the heck do these codes mean in this field, right? Why is this field named some random PBR FXQ?
Yeah.
Well, what does that stand for? What does it actually mean? What is the purpose of why this information exists? And how do I use it, right, to get to that answer? So that's the purpose. And sometimes it's like, yeah, I'm just going to write the codes in here, right? And the other thing I learned is, how many of you are familiar with code books? Yeah, okay, I never heard of that term. Code book doesn't mean anything to me as a data as where I came from, but that's the other thing for the code book, which is more of a health related thing, I guess. It's like, again, similar thing, but it is metadata.
Definitions.
Yeah, but that's
Explanations.
Code book?
Yeah.
Codes?
Yeah.
Right, the book of codes, yeah.
There are a bunch of different code books, diagnosis codes, CPT codes,
Another key thing about metadata that seems to be forgotten frequently is information about when the data was captured, like the time relevance of the data that you're looking at. I've looked at too many data sets that are like unclear. When was this updated? How often is it refreshed? Things like that. And sometimes the systems that you house your data in will kind of prompt you to already do that, but sometimes they don't. Okay, so thank you. I'm going to pause here again and bring it back to you all for questions and comments. Yeah.
This is for Mark. Hi, Mark. You mentioned earlier that you're as the CI Chief Data Officer, I guess. Your that department or that office is like the strategic arm of the county. Can you elaborate on that? I mean, does your office provide governance to the different the 39 county departments? And do you consider like that office to be the stewards of the county-wide data, or do you work directly with the county departments as far as providing them governance on data, or?
So unfortunately, the answer to that is no, because it's just me and one other person, right? So what we have as of last year is we have an analytical group that's working with us. So what we focus on is, in terms of strategy, is to work with departments to establish governance within those departments and establish data stewardship within those departments to identify kind of what we're talking about, what we would kind of call information maturity, right? So there are a number, the goal is to raise the information maturity level of all of our departments. So within DHS, the fact that they have a governance committee and they are working towards data standards within their domain is actually critical, right? So that's a robust and a fairly mature information group. Whereas other departments haven't even started thinking about data standards, right? So our job is to enable departments to build the maturity and to measure that and to establish benchmarks and standards around identifying themselves. Well, we're at maturity level 1, right? Our goal over the next 2 years is potentially to get to maturity level 2. You're not going to go from 1 to 5, right? Based upon what the values that's provided. What we are enabling, though, again, is to build a platform as well, technologies to support that. So when we talk about measuring accuracy or measuring quality, so we have enterprise software that can help with that. And we have one of our main goals is we have our data governance catalog. So the idea there is that departments control a piece of that where they govern and define all of the data that they have controlled, but in a countywide approach, so that there will be one catalog of county data, right? But it makes it challenging because we're going to go to departments and say, hey, please enter all of your information over here, right? So when we talk about the challenges is how do we get everybody to buy into doing that and the value? That's always been the challenge that we have.
So the county departments, you're saying, because governance is actually like decentralized, I guess now
We are a
different departments,
federated
right?
entity, right? So it's a bit of I don't have the explicit authority to tell Toki to go, your data's crappy here, go fix it, right?
Okay.
Right? I can say, please.
But you can provide,
No, here's the business value.
you can provide governance to departments, like smaller departments, I guess, or something
Well,
that do not have that. I'm
so-
just trying to understand what your office's role is, I guess.
So what we are looking towards doing is saying, health agency, right? Health department, you need to have a governance structure in place for your data. You need to have a data steward
Okay.
for the information, right? And identify that. And that's where we're going. So we are less stick than more, carrot.
No mandates coming from your office, but more like supporting.
We're
it.
getting there. I mean, our board is very interested and is very supportive, and that's one thing that we have an advantage of. I think the city does as well, as our board of supervisors is interested in data-driven decision making. So they put out a lot of motions around data stewardship and that, but they're still at an extremely high level, business level. So it's we work on what we can. And so the model that we've taken is, what's our business use case, is to bring together certain core sets of information about individuals, right, that interact with the county, and govern and steward that information at a countywide level.
Okay. One last question. Let's say, like you mentioned several initiatives like the homelessness and all that justice reform systems and stuff. So does the board of supervisors, executive office then come to the CIO for, like, say if they need like homelessness, whatever data they need for that initiative? And do you go to the different departments to capture that data? Because different departments, like say DCFS would be like, say, for the child protective system, and justice reform, of course, like sheriff. So how does the CIO fit in that, like say that, the county, as a whole?
Usually the way that it works, and you've seen motions that come out of the board says something, CEO, which is and CIO,
Right.
in partnership with all of these departments shall report back on the impacts of justice reform, right? So then it establishes this partnership, because we are kind of responsible for the overarching report back or response. But fortunately, the board understands it's the departments that are also part of that. So it's that sometimes we are the primary, or sometimes we are supporting. It depends upon how, the motion itself as it comes out. Hopefully that helps. But with these broader initiatives like homelessness and child protection, there is actually they established offices that are the responsible parties. So our job as the data wranglers for the county is to support them.
Mm-hmm.
So we have a big homeless initiative, right? There's 10 people that run that, but we support their responses to the board around metrics, around how many people they've housed, things of that nature. So they work with us, and then we work with the departments to go collect that information.
Thank you.
Yeah.
Any other questions in the room? Yes.
So the question that I have is about translating the importance of gathering data on a much smaller scale. So say your data is associated with individual cases and individual patients per se, that sort of thing. How do you communicate the importance of capturing data with someone who for instance, is super overwhelmed and is just like, oh, now I have to fill out a survey at the end of every thing explaining, what type of patient they were and if they did or did not come from another facility and things like that. Is there any tips, tricks, or tools that you have in making the business case to the employee who then is the one essentially producing your data for you?
Mm-hmm.
How do we essentially
Change behaviors.
communicate the importance and the business case for that employee about how that data is going to assist them in being better at their jobs?
Sure.
and
No, I think that's a really, really good question. I guess I'd say that it's also a challenging issue to tackle. I think the most critical thing is to really understand what the day-to-day is for the person that you're trying to work with. I found a lot of success from trying to shadow or work with like our operation or field staff to make sure I understand, like, okay, if I'm going to design a form or have someone work with them to try and get data from them, I can tell them what to fill out. But if I don't really understand how they're going to fill it out, do they want to fill out mobile, or are they going to go back in the office and fill it out, or in trying to understand what the process is that they're going through helps to develop a workflow that is easier for them, because more often than not, they're probably filling out some sort of paper form or something already, and it's just, and if you understand what they're going through, then it helps to make it easier for them. And the other thing I'd say is it's absolutely critical to make sure that if you're asking for more information from them, to make sure that it's very easy for them to fill that out. And because you can ask 30, 40, my background's in economics as a researcher before getting into government. And I was like, oh, I'd love to get all this, like all these different columns, all these different data sets. And more often than not, it's better to simplify and make sure it's really accurate than to ask a whole bunch of extra questions. And that helps to get buy-in from them too, because then they get quick, easy results too.
I would add that communication needs to be going two ways.
Mm-hmm.
You don't just tell them something, you also listen. And for example, we came up with a standard for no-show appointment status at our clinics and had to capture it. And one of the pushbacks that we got from registration staff was, we have 50 people in front of us. We are trying to check them in and all of that stuff. I don't have the time for somebody who's not here to go through the schedule and then go, oh, by the way, this person didn't show up at 10:15, they showed up at 2:15. So what they were doing at the end of the day, they were going through everything and no showing the person. So I could have gone for my appointment at 2:15, even though it was at 10:15. And in the industry, that's a no-show. You're not just late, that's a no-show. So we actually worked with the staff to come up with a definition that actually works. So communication needs to be going both ways.
Yeah. Thank you.
Sure. Yeah, the other thing is, can you provide something back that helps their day-to-day work?
Mm-hmm.
Sometimes it can, sometimes it can't, but I'm always feel really bad for all of the county workers that have to fill out these freaking forms, right? So one example, like one of the things that you could potentially do, I don't know if this is feasible, but do you need to actually even input no-shows?
Mm-hmm.
Couldn't the system say, hey, I didn't check them in at 10:15, automatically assign them as a no-show if they don't check in within a certain amount of time? So get rid of a box. Get rid of a process, right? So sometimes information can be used to answer questions based upon a much more limited set of information, right? And stuff, capture what you can, like the least amount of work, and as you said, that should help increase the accuracy and currency and completeness, right? So complete, accurate, current information is much more important than a whole lot of variables that are somewhat captured. So, and if you can generate, think about as well, generating what you can, another variable that you can generate from a combination of other things, right? That's the most that you can do, I think. that can help a lot.
3 more minutes together. Any more questions? Feel free. Yeah, any last comments from you all?
Oh, yeah.
Oh, sorry. Go for it.
So if you had kind of one hope, like looking back from 5 years from now, where we are as a region, working on data practices and governance, like what would that be?
I want all the data. No. Well, what I'm hoping that within 5 years that what I'm hoping is that we move from descriptive analytics. So a lot of what we do around the county right now is descriptive, right? Looking back in time, what are the trends? Starting to look at predictions, right? So predicting the risk of homelessness, predicting the risk of child abuse, predicting patient care outcomes, right? To enabling that, and then moving towards prescriptive analytics, which is a patient arrives on our doorstep, right? And based upon historical information and predictions that are out there, there's actually a treatment course of action that is actually prescribed, right? That this is what you should do with this patient. But that's not the only end, is actually monitoring the impacts of the programs that we have on a live basis and providing that back to the caseworkers and staff members that we have, right? So that's where I want to be in 5 years in order to, and do it as accurately as possible, right?
I agree. Predictive analytics is where I want to be in 5 years without a whole lot of human interaction for that predictive analytics.
No, I agree with those. I'd say because water's so fragmented, just having data that is shareable should be federated and open in the water sector.
Yeah. And another big thing that I'm actually trying to, that I'm hoping to enable is self-service analytics as well. So a lot of times what happens is big data warehouses like the one that you run, I don't know how open it is, but once you get to a curated set of information or information that you trust, then you're less, there's this concern of, well, the information, you need experts in order to to understand what the quirks are, tends to go away, and then let the people that are out doing the work actually build their own capabilities or build their own some analysis so that they can drive the business forward themselves.
What
right?
did you call that?
Self-service analytics is what you hear about. So what I'm hoping, so we are working with 9 departments to bring in all this information, a fair amount of information from each of these departments. Once we have metadata about all this information and we understand, like at least from a data stewardship perspective, what's strong and weak about the sources of information, make that available to the analysts within those departments so that they can answer questions that we don't even think about. Right?
That's empowering.
Yeah. So, if you're using Power BI, why not on the left have all of the information across the county from a client perspective, but knowing we have to be able to explain, well, this is what this means, this is the accuracy and quality of that. So if we can get there in 5 years, I'll be really, really excited because that's going to explode what we can do.
Yeah. We'll take one last question. Yeah.
That was a really great point, predictive analytics, because I'm curious as we build a policy based on the data results collected, how do you use your summary of the past, collected data, and create the predictions of the decisions and the policies being made? Let's take, for example, we had a Save the Drop, which was a big campaign, right? You knew a lot about that. And then certain actions or programs were put into place with DWP regarding removing your front yards, right? And then we had people taking advantage of the, not all of them, of the incentives. So if we were to predict, the outcomes of that, how do you overlay that and build that into the strategic plans and policy making together? It's a big question, I know.
So, well, before you answer, Mark, if you would like to break now for lunch, feel free to go ahead. We'll answer this last question, and then we'll all be done. So before you do leave, if you are leaving, let's give the group a round of applause. And they're going to stick around for a little while as well, over lunch if you want to chat personally. But Mark, I'll let you take that last question.
Well, I think it's for, also within health, there's a lot of policy impacts. It's yeah, that's going to be very challenging, right? It's like, I think that what we need to understand is what are you trying to change with the policy? And that's the starting point. And that to me is actually beyond my expertise. That's where my researchers and understanding policy and analytics, where we lean on them to identify, do you use artificial intelligence, or what are the algorithms that you're trying to use to identify what could change based upon a policy, right? Mm-hmm. So the policy is trying to change a behavior, right? How successful was that change? And then what is the impact, right? So save the drop, like, well, we saw this result, right? And then what was the impact of that result is the next phase. So as you design policy, right, you usually try to change some behavior, which is measured in some location, which then has an outcome somewhere else. So as long as we can identify which of these data elements we want to change, I think that from a data perspective is where we want to get to. We want, less admissions of type A, but more of type B, because we think that this is going to be the outcome, I think. Hopefully that. It's a complicated.
It's very complicated. Is really going to help what your status is, right? Or what your policy change is going to be, because you don't want a negative predictive outcome.
Yeah.
It's thinking too.
Absolutely. No, I think it's like developing the life cycle of a given policy intervention or a pipeline, so that, like, if you're going to, for the water analogy, if you're going to do a water efficiency program, you're going to have marketing associated with it. You're going to be monitoring water usage. You're going to be looking at participation in that program, and you're monitoring behavior of the people who are participating. And so that what it does is creates more flexibility in the policy intervention, so that if for instance, you notice a shift in who's participating, if you notice a shift in the impact of your advertising, it allows for a far more cost-effective way to approach these types of problems. And really, it's kind of as it was laid out, it's connecting these different data systems. And once you have those connected, it's actually a relatively simple problem to monitor. I mean, you look at especially with like digital advertising, with people using more digital applications, with enterprise systems, and how those can all connect now. So it's investing and connecting those, and then you can really make it so that we work more cost effectively for the people we serve.
Yeah, one of the interesting things when you talk about water during the drought, remember, it was like, nope, you have to cut your water usage by 30%, right? It was like mandated. Like, as we go forward, should that be like, that's one policy way to do it, right? You have to, right? Otherwise you're going to pay a fine, right? Or more incentivized, like, oh, we'll pay you, that's the carrot version, right? Right. So, but what's the outcome, right? And what are the measures that tell you how you're moving toward that outcome? So that's where, as you have robust information, maturity, and you understand how the information flows to measure something on the outcome, that's where we need to get to, so that you say, well, I want to change this to change that, right? So then you can start to look at you can start to predict or estimate, well, in the history, if we've seen the change historically in this measure, well, we've seen this thing change over here in this way. So the policy and law can, identify, is this what we want to change, or is this,
Well, Drew, Toki, and Mark, thank you very much. This has been awesome, even just for me. I'm like taking notes. I wasn't texting, I was taking notes. And thank you all for being here. Hopefully you stick around to meet each other over lunch, which is happening right in the kitchen across the hall. Thank you.
Thank you.